A major change has been announced at the state capitol about who pays for mammograms. First Lady Frances Wolf says Pennsylvania law now ensures that every mammogram is covered by insurance at no extra cost, including 3D screenings. Newsday's Harrisburg reporter Portia Johnson has more.
A standing ovation after the First Lady made the announcement at the Pennsylvania Breast Cancer Coalition conference. The coalition says the 3D mammograms are the newest technology, which allows patients to get an earlier diagnosis, and it reduces the chances of false alarms. The coalition says many patients have had to foot the bill for these high-tech mammograms in the past. However, the First Lady says the governor's new policy is that this will no longer happen, a decision she says will help save lives.
I think everybody has a story. This is not something that only applies to a few. It's universal, sadly.
Portia Johnson, News 8.
And the president of the coalition says this ruling just clarified what was already Pennsylvania law, so it takes effect immediately.
In the not-too-distant future, ultrasound may become the gold standard in the early detection of breast cancer. That was discussed today at the annual conference held by the Pennsylvania Breast Cancer Coalition. CEO Pat Halpin Murphy donated $50,000 from the coalition to researcher Dr. Wendy Berg. With that money, next week, Berg will begin a 5-year study involving 6,000 Western Pennsylvania women. She's going to look to see if what she suspects is true, that ultrasound is better at detecting invasive cancer. She says it's already easier and cheaper.
Ultrasound is an extremely attractive option because it can be done very inexpensively now. The equipment that you can plug into a small laptop or even an iPhone soon will be sufficient.
Also, the coalition, working with First Lady Frances Wolf, announced that starting now in Pennsylvania, there is no upcharge for 3D mammograms, so you should no longer get a bill for those 3D mammograms. And ABC 27 was a proud sponsor of this conference. Flora Val and I were happy to represent the station at today's luncheon.
So it's just dawning on me why everybody's wearing pink.
Right.
I'll wear mine tomorrow.
Yeah.
Because it's a whole month, right?
All month long. We need to get you one of these, too.
Very nice.
The Pennsylvania Breast Cancer Coalition presented a $50,000 research grant today to help fight the disease. The grant went to Dr. Wendy Berg of the University of Pittsburgh School of Medicine and the McGee Women's Hospital. Dr. Berg is working to make sure fewer women are diagnosed with breast cancer at later, less treatable stages because they have dense breasts. Her study plans to determine if 3D mammograms or screening ultrasounds are most effective for women with high levels of breast density. First Lady Frances Wolf was at that event today and took time to make an announcement about women's health care in Pennsylvania.
My husband's policy is that regardless of the mammogram ordered, Pennsylvania law ensures that every woman has access to a mammogram, whichever one it is, at no cost to herself.
The PA Breast Cancer Coalition has awarded more than $3 million in grants to researchers in Pennsylvania over the last 22 years.
As we mark Breast Cancer Awareness Month, we also need to acknowledge the tremendous progress that has been made against this disease. And at the forefront of this progress has been the Pennsylvania Breast Cancer Coalition. As technology to screen for breast cancer evolves, we all need to make sure that women have access to that technology. And the Pennsylvania Breast Cancer Coalition does that. We all know that early detection is the key to survival. We also know that mammograms are vital in detecting breast cancer at this very early treatable stage. In addition to conventional mammograms, many women in Pennsylvania are able to receive now a 3D mammogram. It turns out, though, that 3D mammograms cost more than traditional 2D mammograms or conventional mammograms. They cost between $50 and $60 more. And what we found to this point is that women were being billed for that difference. Insurance would cover up to the conventional amounts that individually we'd have to pay. But I'm proud to say here that now the Wolf administration believes that a mammogram is a mammogram, and it does not differentiate between 2D or 3D mammogram. And therefore,
breakthrough. And they do principally two very exciting things. One, earlier detection. Two, fewer false alarms. So it's very important, especially for women who have dense breast or other complications, to get the 3D mammograms. This is such a breakthrough. It's such a step forward for women, because if women began getting bills for $100, $60, $500, it was all across the board. There was no standard price, and they were getting bills that they didn't expect. Well, what would that do? That would discourage women from getting mammograms. The last thing we want to do. So I want to thank you, and I want to thank Governor Wolf for this breakthrough that will truly save women's lives. Thank you so much.